Honorable judges, me as first speaker of government side will agree this motion that say, as developing country, this house will prioritize the improvement of healthcare accessibility as opposed to the improvement of healthcare quality. Honorable judges, everyone know that health is important for everyone. Every people want to get health service. They want to be appreciated, served, and want to get the same position in society. But in reality, in providing health services in Indonesia, there is a lot of evidence that describe the law of healthcare system. Health services with good quality are only for patients who have a lot of money and also in more developed areas. Then, patients with low economy, especially those who live in hard-to-reach area, have not received good care that they should have too. They have a difficult experience in accessing healthcare. This can be caused by geographical condition, limited transportation, and various social problems that they have to face. All these problems can occur due to lack of access of healthcare. The meaning of improving accessibility of healthcare here does not mean that all healthcare do not have efficient accessibility. The expected accessibility here is where people can get access to proper health at an affordable cost too. For the right definition of healthcare itself are health service where they are in conditions that are easy to reach and people have no difficulty accessing the healthcare itself. And this is focused on them, people who live in hard-to-reach areas, also with low incomes, who experience difficulties in accessing healthcare due to various economic problems or other aspects. Honorable judges, why do we have to discuss this motion right now? Because if it not immediately followed up, this condition will attract more disadvantaged people. What if this condition is increasingly ignored and there will be public disappointment with healthcare service, which actually drains their energy to get it? What if improving the quality of a healthcare is still being carried out while residents who have difficulties in accessing healthcare cannot feel and get it? Of course, that is a pointless thing and is something that no one expects. Because of that, it is obvious that improving access to healthcare is more important and useful for everyone than improving healthcare quality. Anyone knows that access is more important, especially for them, people who have difficult experience. To follow up on this, as the government side, I am adopting a mechanism which is the government is required to provide conveniences such as subsidy or in any other form in order to facilitate public access to healthcare. My goal regarding this motion is very obvious, honorable judges. By releasing the mechanism I mentioned earlier, a high quality of health service will be created, starting with improved accessibility. And that is quite something to be proud of for our country as developing country. Let's move on to my argument which states in this developing country we can improve well the accessibility of healthcare. Honorable judges, improvement of healthcare accessibility really help those who live in areas that are difficult to reach and have low incomes. Indonesia is a country with a heterogeneous population. Because of that, the health service providers should take this situation into serious. There are many sad cases where people are late to or didn't even get health service due to limited abilities. Whether from economic ability, transportation, or various other social problems. There are many examples of solutions that can be implemented, such as we can add more hospital instruction to areas that are difficult to reach, transportation subsidy assistance financial, or subsidy assistance in any form. With more and more accessibility, it will make it easier for people to get health services according to their needs, from ordinary service to emergency service. And other side, this also saves expenses for those who are in hard-to-reach areas and those who have low economic, especially for limited transportation, because the access distance is shorter than before. So with this, I'm sure the healthcare system in Indonesia can improve more and benefit more people who live in it, for the sake of the bright future of this developing country itself. Thank you.